Class, I hope I have your attention. I really am looking forward to hearing your responses from the unnatural causes and sickness and in health video that you watched and the readings, etc. Um, let's talk about addressing social determinants of health. It's time to get started. And where are we? Do we know what the social determinants of health are? They are the social factors that influence health, not just at one point in time, but over the entire life course. And what do I mean by that? From cradle to grave, or from womb to tomb, from the day that you are born, these social determinants are carried with you. There is a cumulative burden. So, for example, if you live in a society where one race or ethnicity is at a disadvantage, it will determine, or likely determine a lower, a neighborhood that doesn't have a lot of advocacy, that might have lower quality schools. If you attend a lower quality school, you might have lower educational attainment. The lower educational attainment may lead to lower job potentials, lower earned income potential, etc. There is just a cascade effect of the doors that will close for a particular social determinant. So it can also rob populations of productive years of life lost and impact the quality of life that a population can live. So 3 overarching threats to social determinants are economic inequality, social connectedness, being part of a marginalized group that doesn't have the ability to come together and advocate for better conditions are going to be marginalized, and the sense of efficacy, the confidence in being able to change and come together to make improvements. Those are threatened. So what does it result in? Differences in exposures, differences in vulnerability, and differences in the consequences, health consequences, economic, etc., for different populations. It is not something that is universally experienced. The social determinant is variable by geography, by ethnicity, by race, by gender, by class, by whatever the social structure is. So some specific social determinants can include racial and ethnic biases, cultural differences, media influences, politics, living conditions, geography. We're going to go through even more. So now we're going to get into why. Why do we care and why do we address them? Because if we want to solve problems and prevent disease and prevent negative health impacts that are tied to lifestyle, we must attack root causes. And social factors have more resonance than just the health issues alone. If you remember in the Unnatural Causes film, Mary, the one in the lowest social class, she feels her health conditions, but it is not being able to go on vacation, it is not being able to put food on her children's table, not being able to live in a safe place. Those have the greatest impact versus her health, her wellness. So addressing social determinants involves a comprehensive approach, which you have to work with communities that have been isolated so that you understand them, that you see the situation through their eyes, not as an scholar or an academician, you must get to know your community in order to both maximize the return on all of your investments in public health as well as the value of your investment. And addressing social determinants presents a tremendous opportunity for learning and community leadership development. So, how are we going to do this? Well, we need to address social determinants when it's clear. We can't just look at heart disease. We have to go further. Heart disease is skyrocketing. Obesity for women is increasing. That was just in the news. Just focusing on a medical condition, prescription drug abuse, we have to dig deeper, because when rates are not dropping off like they should, we need to find out why. And we need to advocate for changes in laws and policies and get more research attention for things that are keeping, a veil on what's the dynamics of what's causing that. And we need to also seek fundamental change so that we can achieve long-term solutions to long-term problems. And if we really want to walk the walk or live this life of the song we sing, we must focus on true wellness and prevention overall, not, like I said, putting a Band-Aid on something. It is truly making a community healthy and vital and integrated back into mainstream society. So how do we identify social determinants? You assess your communities. You respond to observations and experiences. I know a lot of you in your personal introductions, you have traveled to many different places, but you don't even have to look that far. When you come to GSU's campus or any community you live in, you know there are homeless individuals, there are people that are poor, there is no end to suffering. You must, instead of turning that blind eye and getting thick skin as a bystander, you have to start asking more questions and muster courage to shake off those things of just letting things continue. You have had friends who have experienced things. You have had family members. We are not, the degrees of freedom that you are separated from the health problems in which we're trying to improve in public health is not different. We're part of the public. So we need to work together to get this hard work done. And there's tools to help us address these, and we're going to go through all of them. We're going to figure out how we can change social environments, physical environments, policy conditions by increasing people's knowledge, increasing their skills, by offering support both within and between different groups, modifying access to or barriers to get to resources, opportunities for services and resources. We have to have consequences when actions are deliberate and perpetuating social determinants of health. We need to address exposures to hazards or protect people from those. And we ultimately, the greatest tool we have that can have the most amazing public health results on a population level, we need to advocate and change policies. So we have guidance provided by our principals that we can't do this work without having a task force. We need an entire group of people, and not, like I said, you are so lucky to be in grad school and it's wonderful, but you must be the lead of a movement. You must involve the people that are affected so that your ideas for solutions have the best chance of succeeding. And true change in improving social determinants demands comprehensive intervention. So you learned about the ecology level. We can't just try to fix obesity by having personal diet plans for individuals. We need to fix zoning policies so that, you know, on Martin Luther King Drive, it's not overrun by fast food joints and pawn shops and everything else. That we need to really fight for fresh produce and get rid of food deserts and recreate areas so that health can exist. We need to support organizations that build capacity so that a community can control its own fate. And I missed bullet point number 3, that we have to aim for change across sectors. We can't, we need to really foster relationships between law enforcement, social services, healthcare. You know, physicians and the medical community is just one part of health. There are so many other partners that need to be present: schools, workplaces, homes, counselors, you name it. Everybody has a place in public health. And health and development efforts should involve collaboration. These strategies that we come up with should be self-sufficient and sustainable. They should be aimed at goals that can be accomplished by people in question with resources available. And success should be consolidated and maintained so that the next challenge can be taken on. So we should continually advance. We're constantly getting better. And when we have one milestone met, we can push forward and get the next one.